enhance our competitiveness and to improve productivity by promoting not only decent work. HRMATT is also interested in promoting productive work and encouraging naturally a healthy lifestyle with key elements that advance for not only productivity in the workspace, but individual and organizational competitiveness. And essential and critical to that, of course, is overall health and wellness. We should also remember that part of ILO's goal and objectives for a decent and productive workspace, it involves and includes opportunities for work that is not only productive and delivers fair income, security in the workplace, and social protections for families, but it also looks at the rights of both parties and protect those rights as it relates to safety and health at the workspace. That being a very core element of some of the ILO's agenda. So therefore, for us at HRMATT, safety and health at work is a key component of any basic employment plan, and any organization seeking to achieve significant and inclusive and sustainable growth certainly should be looking at the overall health and safety and also wellness of their employees. So safety and health is essential to us here at HRMATT. So it was a no-brainer for us when we consider not only the ILO's agenda, but also Millennial Development Goals. And as we seek to not only contribute to overall health-related issues in the workspace and in the wider community, but certainly seek to promote good diet, physical activity, the information centered around chronic illnesses and diseases, promoting healthy lifestyles and better choices, things like that. We certainly found in Patient Connect an excellent partner to launch this Wellness Hub, recognizing too, especially the fact that a lot has changed since the pandemic, and we wanted to make this service accessible and affordable. We incorporated a bit of technology into it as well. So that is why it's also being served as an app, making it very easy for you to access these services at your fingertip. We recognize every employee, or most people, have access to a digital device, and certainly that will enable them to access these services and information and support needed to promote healthier lifestyles and to promote mental and physical well-being in a more accessible and affordable way. So it's for that reason, it was a no-brainer for us to work with Dr. Muradali, who's here and will be joining shortly, to do the demo, and to partner with them to bring this innovative and new way of addressing health and wellness in the workspace. So for those of you who have taken the time to join us this afternoon, I say thank you, and I do look forward to your feedback and questions later on after the demonstration is completed by Dr. Muradali, as we seek to really break ground and to get this basic service up and running, provide easy access to health information and services to not only employers, but to employees, looking at really revolutionizing how we address health and wellness in the workspace. I am happy to be here and to partner with Patient Connect, HRMATT, that is, I should say, not me individually, but HRMATT certainly welcome the opportunity and look forward to your positive contributions in the dialogue this afternoon, and to you joining the Wellness Hub as we seek to really promote and encourage overall health and well-being in our workspaces and throughout Trinidad and Tobago. So without any further ado, I welcome you and do enjoy the presentation this afternoon.
Thank you, Cavell. I will now ask the CEO of Patient Connect to join us as he will do the demonstration for us, Dr. Navi Muradali.
Hi, good evening all. Thank you very much for those greetings, Cavell. And as usual, I think you really encapsulated the human resource perspective and why it is so important that we have wellness programs available to all employees in Trinidad and Tobago and the wider Caribbean. So I know it's a working lunch for many of you, So I will go directly into sharing the screen, and we will just briefly go through some of the main points of the HRMATT Wellness Hub. And so I hope that, you sit back, relax, enjoy your lunch, and you watch a little bit about what we are going to be discussing today. So I just need someone to tell me that they're seeing the screen.
Yes, we are.
Yes? Okay, great. So this is a link that we will be sharing with all of you all, and it basically summarizes the agenda for today. And on the agenda, you would have noticed that we will talk about how to access the Wellness Hub, the benefits to the employees, the cost, and we will certainly be taking your questions and answers. So, and we will provide as much information in this short session. And I will also introduce a dietitian and a psychologist to you. Once they're here, they will say a couple words as well. So when you go onto this page, you will see that, and so this would be for HR professionals, CEOs, managers, HSC officials, to be able to go through this page. And so you will learn a lot more about the Wellness Hub. We're basically a chat-based digital wellness platform for employees. What does that mean? It means that it's available on your phone, and the employees can actually chat similar to WhatsApp they can chat to healthcare providers. There's also the artificial intelligence, Omni, that we'll be introducing later on in the year on the platform. So if you were to get this link and you want to get more information, you can click Request Info. There's a little bit about the Wellness Hub here. And it's really a chat on the go for employees. And these are some of the questions they can ask. Where can I find a personal trainer? Any good brand of vitamins? Where can I find a doctor? I have anxiety. Who do I chat with? Those type of things. So many of the questions you will find, sometimes employees are coming back to the HR professionals and asking some of the questions about accessing their EAP or accessing a medical service. But a lot of this can now be done using the Wellness Hub. These are a listing of the providers that you have access to. So on top of the list, because we have done this in other programs, we always find that mental health counselors are usually top of the list, followed by doctors and dietitians. And then the rest of the persons, such as pharmacists, nurses, dentists, physiotherapists, patient educators, and so on, they are also sought after. So we will go through the demo of the app in a couple minutes. We do support all of the various aspects of wellness, and you can go through the listing here. So what we try to provide is not just the standard wellness that you're accustomed to, where sometimes you may have a doctor come in, do some blood pressure, sugar, have a mental health counselor or a dietitian. We try to provide many other aspects, such as financial wellness, environmental wellness, and so forth, to the employees so that they learn more about the holistic wellness. Now, the problem that we're trying to solve, and this is the problem that Patient Connect, which is why we got into the space of telemedicine, telehealth, digital wellness, is really one that I think we're all very familiar with. And in the Caribbean, you fully appreciate that we have a lot of lifestyle diseases, diabetes, heart disease, high blood pressure. We also, post-COVID, we have seen a rise in mental health challenges. All of these things come at a huge economic, social cost. You're very familiar with that. If you're HR, your CEO, absenteeism, low productivity, you name it. You have the issue of group health insurance plans increasing because people are using a lot more of the services. So you find that there are a lot of economic challenges as well as the challenges with respect to the employees dealing with HR because of this. So what can we do in the digital space to really bridge the gap between the private sector and the public sector? And this is where we have really created the Wellness Hub to sort of bridge that gap and provide very affordable services to the employees. As I said, in a couple of months, we shall be launching the AI part of it. Now, the AI is not here to diagnose and treat. The AI is really to support the employees and HR professionals in accessing information about employee wellness programs, providers. So you don't have to go and do all that heavy lifting anymore and go on Google and search around. The AI will be there to really assist you in supporting your employee wellness programs. So I will move across to the other part of the presentation, which is why you're really here to see the demo. So we will go through the demo. I'm not seeing the page coming up. So I will just move on to the next. Okay, so are we seeing the new page?
Yes, we are.
Okay, great. So when employees come onto the Wellness Hub, and I'll show you how easy we have made it for them to get access to the Wellness Hub. When they come onto the Wellness Hub app, they are greeted by this graphic and the information. So it really tells them that the HRMATT Wellness Hub is a collaboration between HRMATT and Patient Connect, and employees can access health. So they understand, okay, they can access health services, wellness services, fitness articles. They can also get promotions, and we will talk about why we want to increase the engagement of the employees so that they can use the service more. So promotions form that basis for that. And they can also get access to many of the other services of the Wellness Hub. And they can also live chat for free with the care providers. And we will kind of do a quick demo on that. We also explain to employees the app is safe and secure. It's HIPAA compliant. So for those of you who don't know HIPAA, HIPAA is a US-based, a North American-based regulation that covers patient health information, or PHI, so that the data is secured, and we use HIPAA compliant forms and a HIPAA compliant server. All of this is encrypted on Amazon Web Services, so none of the information is stored locally. And we try to ensure that we have no servers here, so that everything is stored on the Amazon Web Services cloud, and it's encrypted on their side. If you want to learn more about HRMATT on the app, you can click on the link, and it takes you to the HRMATT's website, so you can learn more about HRMATT. We usually post every few days a new video, so that persons in the morning, they want to get a warm-up workout, or they want to get some information about maybe some sort of dietary advice, they can get it through the videos. So we normally post new content quite regularly. We kind of give a little information about what is employee wellness. So in this case, there's a little some information here that they can read about employee wellness. So now we come into the services of the app. So what are these services? So let me click on the live chat. So live chat means we go to another page. I hope you could all see this page. It's called Knowledge Hub. Yes?
Yes. Yes, we can.
Okay, great. So when you come into the Knowledge Hub, you can search various topics. For example, you want some information about diabetes. An entire listing of topics, articles will come up. They can search for mental health articles. So let's click, for example, on mental health. Let's look for an article on work-life balance. So, what is work-life balance? So work-life balance refers to finding a healthy equilibrium between the time and energy spent on work-related activities and so forth. Then they can scroll down and can read, so how can I achieve this? how can employers promote work-life balance? So employers can promote work-life balance by fostering a supportive work culture, encouraging work flexibility and remote work options. So I know that's a big thing, remote work. So they would have access to hundreds of articles. Many of these articles are written by our local providers, for example, psychologists who are part of the Trinidad and Tobago Association of Psychologists. The articles on nutrition, we have asked members of TANDI, the Association of Nutritionists and Dietitians, to provide articles as well. So a lot of the information is local content. It is not something that you're getting from the Mayo Clinic or somewhere. We try our very best on the Knowledge Hub to make the content as local as possible. So it is very relatable. People can really understand, it's part of our culture. So this is one of the strong points of the Knowledge Hub and our articles. So you will see a whole listing. They can search for mental health, nutrition, fitness, pharmacy, supplements, beauty, medical facilities. The list goes on and on, optical. So there are many, many articles on this page. If they want to chat, so they click on the Let's Chat button. And when they first enter the site, it's some information about using the service. So they're providing consent to provide their information in accordance with HIPAA, GDPR, and our local data privacy and protection regulations. We do not share any information to your employer or any third parties. And we continue with the information here. So once they accept it, this information pops up. So again, they can either live chat with the AI when the AI is fully functional, or they can speak to a care provider to get support for free. So what does that mean? So they can begin this chat and they can ask those questions we saw earlier. I'm feeling anxious, what can I do? And our mental health counselors who are on call, they would be responding to the employee and they can give some basic advice. It's not a full consultation, but they will give some basic advice about how you may be able to manage your anxiety at the moment. Maybe take some deep breaths, and they would stay with them to ensure that, they can get that support. There's also a video and a voice part of the chat. So it's not just the chat like on WhatsApp, it's video and voice as well. And then they could also engage a dietitian, a doctor, pharmacists, and wellness providers, financial planners, and all of these other persons who would be on call to be able to have some engagement with the employee. So again, it's prompting you to ask certain questions. What's a good vitamin? So it could be as simple as that, or it could be something more urgent, like they're feeling anxious. Of course, this platform, and we stress it a lot, it's not an emergency platform. So if there's an emergency taking place, that's 811, that's the ambulance service. So this is not for very urgent care or emergencies. And this is where now all employees would be given a subscription code. So they want to choose the department. So they want to chat with a dietitian. They enter their name, and they provide authorization to use the service. And then they start the chat. Now, the goals of, a wellness hub would be to lose weight, become healthy, get strong, stay toned, reduce stress, be mindful, sleep well, and I'm sure you could probably find some others. But that is really the purpose of this, to provide that support to the employees along those lines. So the chat part of it is very simple. So once they start the chat, they go into the chat room, and whichever service they selected, in this case, if they selected a dietitian would respond to them and they could begin the chat. It's very similar to WhatsApp, but it has the HIPAA protection and it's encrypted on Amazon Web Services. So that is a little bit about the Knowledge Hub. I would now go back to the main page where we came from. And of course, we will take questions. So, okay, so that was just one part. So this Wellness Hub is very extensive. So what I showed you there was just one aspect of it, which is the Knowledge Hub and the ability to chat with care providers in real time, or the AI when that is fully on board. So many times I have done the wellness programs for various companies, and sometimes 40, 50 people come out. And when I finish with everything, the HR persons will say, how do we keep the engagement going? How do we keep their interest? How do we, is it a one-off kind of thing? And one of the reasons I think we included a promotion page is for so people can boost the engagement. Employees can keep coming back to see if there are any special offers on a daily basis. And that usually works, because sometimes you may get a 1-day free pass to a gym, or it might be a 1-month pass to the gym. You might get 50% off some supplements that have now hit the market. Other than gym membership, some providers may be offering certain free classes or free services. So it's something that we think that benefits the employees and it boosts the engagement. So at least if they come back to look for the offers, they will be using the app more frequently, right? The other part of it would be request care services. So on the request care services, it's very simple. Again, they just enter the basic information. So they may not want to chat, but they may want to say, okay, I need a mental health counselor. I'm looking for somebody to give me some advice on the medication I'm taking. So I want to reach out to a pharmacist, maybe a wellness coach. And in terms of the specialties, they may be looking for a surgeon. They have some issue and they think they need to see a surgeon. So they can reach out here and they will submit the form, and our health team will look at the request and send our well-curated listing back to the employees. Now, Patient Connect, we are agnostic providers. In other words, we are not affiliated to any particular nursing home or medical center or anything like that. We have basically onboarded all the clinics, the nursing homes, labs, and so forth. So we will give you a very well-curated listing of these services. So we are back here on the main app page. So you will see so many services, and we really encourage you to go through each one in turn. So we know lifestyle diseases pose a major challenge in terms of absenteeism, sick days, having to leave the workplace, go to the clinics, and decrease productivity. So what we have tried to do is to do something that we haven't seen anywhere else in the Caribbean, and that is remote patient monitoring. How we do that is we encourage companies where you have diabetics, you have high blood pressure employees to use our monitoring platform. So I'll give you the example here. If they have high blood pressure and they've taken their reading in the morning, they enter their information here. They advise us if they've taken their medication, yes or no. They can do it in the evening as well. If they are diabetic, they need to be monitoring their blood glucose. So they can enter their blood glucose readings, whatever these readings are. Advise us if they're taking insulin or oral medications, and then they can submit. This goes back to our health team. Again, our health team now will review it, and we can find patterns in this and then reach out to the employee. So we all know that better monitoring means earlier intervention. Earlier intervention means better outcomes. It reduces hospitalizations, it reduces readmissions. And many of you may have that in your workplace. And for companies that have been using this for a while now, I do a lot of company medicals, and I could tell you a particular, I wouldn't call the name, of course. There's a particular company with 50% of their employees, and it's a huge workforce, with high A1C levels, meaning that they're either pre-diabetic or diabetic. So something like this, we have introduced it, and now we could certainly monitor those conditions in real time. You don't have to wait 3 to 6 months to go back to the health center or to go back to their doctor to be able to look at these readings. You know, typically we ask patients to write down the information in a copybook, take it back in 3 to 6 months. How many of that really, you know, is translated into better healthcare? So we have really taken that positive step in introducing remote patient monitoring at the workplace. And we have seen results so far. So the other one, many times you have employees who, and this really works for a lot of the smaller companies where you may not have health plans, you may not have programs where you can afford to have health risk assessments done, but we have offered this free of charge for the employees. So employees complete this form, right? It's a questionnaire, very, very simple questionnaire that they complete online. It's entirely online. You know, I do a lot of offshore work, so I would normally encourage persons who companies here that would be sending persons offshore, that when you have employees there, they may not have access to mental health counseling, dietitians, doctors, and all of the other services, but they can now click, they come onto the app and they can fill out these forms and they can actually, you know, have consultations with all of the providers. So it works really well for where you have employees offshore, and it goes through an occupational history, what their exposure levels are, various things. It goes through a medical screening, family history, medications that they're currently taking, lifestyle screening, such as, you know, smoking, alcohol consumption, some information about their diet. It's a nice BMI calculator here. So if your weight, for example, is 190 pounds, you are, let's say, 6 feet, it calculates the BMI for you right here. So when you submit the form, you already have your BMI. And if you know your blood pressure, your pulse rate, if you, as I said, you've done a finger stick, you could include that. And then it's an open comment section. They can discuss with us what they actually need assistance with. And again, they submit it. Our health team will review this information within 1 week. We normally create a report card for the employees, and then we would suggest next steps. What those next steps could mean, you know, go and do an A1C, go and do a kidney test, you need X, Y, and Z. So that is what that engagement looks like. So this is not a platform where they just come find information. This is a platform where there's always two-way engagement by members of our health team. So I showed you the Knowledge Hub earlier. So if they're looking specifically for mental health support, health, nutrition, dental, fitness, optical, pharmacy, diagnostics, vet, sexual health support, financial support, wellness services, all of this will take you back to the Knowledge Hub, where they would have access to a lot of the articles. And of course, they could engage now in the live chat with those providers to get more information. If someone, for example, they're still finding difficulty accessing anything, we also provide a WhatsApp number. So they just click on this, it goes directly to WhatsApp, and we have our virtual assistant on the other end who will provide that information and walk through the platform with them. So this is the main page, and there are a lot more services. I'll try to just be very quick about the other services. If I can find, there's so many tabs open. Yeah, so this is the home page. This is the resources page. And on the resources page, we have signed MOUs with many of these organizations to provide care for the employees. so they can access more information on Find Care, Alcoholics Anonymous. So, I mean, a lot of companies may be dealing with substance abuse issues. There's a resource right here, and there are other services, other resources, such as the Diabetes Association, Cancer Society, Ministry of Health. So they can go onto the Ministry of Health Facebook page, and they can see what the Ministry of Health is doing. We are partners with the Art Society, and for information about their health or medicines that they're taking, they can log in, they can go to the NHS pages. For the paid services on the platform, for example, if they want to do a telehealth with a provider, maybe 1 session, 2 sessions or so, and there is a payment portal. It's very easy to pay. This is the WePay portal for credit card use. There's also the online banking, and the information is there. And if they have to physically pay a bill, they can go into any of the locations, WePay or use locations where they would typically pay a bill. This portal is also used for the employers when they are making maybe a monthly payment or annual payment for the subscription of the service. So that's the Wellness Hub platform. I hope I gave a very good summary of the platform. And I think we can, there's just 2 things I need to do. I want to introduce Miss Jessica John. She's the president of Tandy. If Jessica is here, I can't see everyone in the listing, but if Jessica is here, you can come on, and followed by Dr. Corinne Clay. She's a psychologist and a member of the Association of Psychologists. And they will just give us a couple pointers about the profession that they represent and how to access some of the services. So Jessica, if you're here.
Yes, I'm here. Are you hearing me?
Yes.
Yes, okay. Good afternoon, everyone, for inviting me, Dr. Murad Ali. It's a pleasure to be here. I'm happy to see so many persons on the platform as well. So as was said, I am Jessica John, the current president of the Trinidad and Tobago Association of Nutritionists and Dietitians. And as an association, we are the professional arm of all nutritionists and dietitians in the country. And at our core, we have 2 objectives. Of course, 1, to serve nutritionists and dietitians, and 2, serve the public. And it is in this vein, the latter one, that we are excited to partner with Patient Connect. When we're talking about health and wellness, we cannot leave out nutrition, and we would want to ensure that the persons that you talk to about nutrition, 1, are legally qualified and legally authorized to do so, and 2, are able to provide what you need. And that's why, as an association, we have to collaborate, because what we have established is that for anyone who is signing up as a healthcare provider for nutrition on the platform, we will be vetting and making sure that the list of names that are coming to us are persons who are qualified to do so. We also would want to encourage you to reach out to us if you have any questions. Get us via Facebook, via Instagram, and also via email, tandy@mail.com. So it's TTANDI@mail.com. And you can get some more information from us. But again, we're excited to partner with Patient Connect in this venture, and we look forward to participation. Thank you.
Thank you very much, Jessica and Tandy. Dr. Corinne Clay, you're next.
Okay, good afternoon, everybody. I am Dr. Corinne Clay. I am a licensed clinical psychologist as well as a licensed IO psychologist and a member of TTAP. So most definitely all of the psychologists that are partnered with Patient Connect and of course with the Wellness Hub, this app has definitely transformed our ability to be more effective with our mental health telehealth services, right? So now we're able to offer counseling and mental health support through not only video calls and messaging, but as well as if the employee wants to still meet with the individual face-to-face, they can do so, as well as they can also call us on the telephone and we can do a session on the telephone as well. Through my practice in CUVA and Higher Potential for Learning, I am able to reach a broader range of employees because many people are in different locations. Some of your employees might have mobility issues and, they're working remotely. So this, platform will definitely help your company provide more inclusivity within mental health support, right? And more flexibility and convenience for your employees, especially those who are now in modern times working remotely, as we all know, right? So I found that with Patient Connect and the Wellness Hub, it's offered a degree of privacy and comfort for many of my patients. They prefer going through telehealth rather than sometimes coming into the office. So this also encourages more of your employees to utilize mental health services. Did I go on mute? Oh my God, so sorry. I thought I muted myself by mistake. But anyway, if you needed to find more professionals within Trinidad and Tobago who are licensed and competent in certain areas, you would just go to ttap.org. That's one way, but also on Patient Connect and the Wellness Hub, we will have our in-depth profile. So this platform definitely has increased the flexibility and convenience for many of your employees. So I hope to be hearing from some of you very soon.
Yes, thank you very much, Dr. Clay, for that insight. There were a couple of questions. We will open it up very soon. I just want to answer those in the chat. How have providers vetted? Providers come through the association. So Tandy, for example, TTAP, the Association of Psychologists, they make the recommendations for experienced providers to come onto the platform. So that is the vetting process for that. In terms of the medical doctors, they all must be registered, of course, with the medical board. And we normally work with the association as well. And so that's really to answer that question. Is there a cost for a provider to be listed? No, there's no cost for our care providers to be listed on the platform. The data gained from the app, who owns it? Well, the data that we get, which would be usage, we normally provide that to the company. So for example, we can tell the company that for this month, 60 persons use the platform, 20 used it for mental health and so forth. But we do not obviously provide any information about the persons who use those particular services. And of course, no information, medical information is provided. Right, those are the questions I've seen so far, but I would like to open it up. You just have about 15 minutes again, so I'd love to open it up for any questions from the audience. So you can raise your hand and we can take any questions. There is a link that was posted, and so that link you can get more information about the various services. Any questions? I'm just going through the so you can raise your hand. Yes, I see a hand. Yes, go ahead. J. Lilam. Yes, go ahead. J. Lilam, you can go ahead. Not too sure if he's hearing. Anyone else has any other questions while we wait for Mr. Lilam? Right, so a good question here is, if you presently use service providers, can you advise them to join the hub? Yes. So if your company has maybe like a group health plan and the providers on that group health plan, certainly they can do so, right? So you could engage with us and we could reach out to these providers. Yes, I saw another question. Chris? have you opened it up for persons to be able
Yes,
to,
I
yeah?
see that Jay is trying to unmute and unmute himself or herself, but I don't know what is the difficulty on their end. But I
Okay.
saw there was another hand raised by, I believe, Tiffany Monroe.
Yeah,
And she-
Tiffany?
Hi, good afternoon, everyone. With regard to usage by staff, I know that the interaction is confidential, but in terms of employers understanding what is the usage, so is this a platform that is actually working for the group? Are you all able to give that type of feedback or stats?
Yes, absolutely. Yes. So we are big on metrics. I'm actually very big on metrics. So we do collect a lot of the information in terms of usage. So the information is, for example, how many persons, as I said, would have clicked on the chatted with a psychologist and from that particular company, and we can do that every month for the company. Yeah, does that answer your question?
Yes, it does. Thank you.
Yeah. For those of you with group health plans, for example, and you want to know how this works out, so we have, spoken to Sagicor and Guardian Group and other insurance companies over the years, and it's a case-by-case basis. So if your company already has a group health plan and you want to know if you can make claims when you use the telehealth on this platform, yes, you can. You just need to have that discussion with us. So that we can ensure that the insurance company and all of us, we are on the same page with respect to the claims part of it. Another part of it is that the telehealth sessions tend to be cheaper than an in-person session. So a lot of the insurance companies love that. And I think you will like that because it keeps the claims ratio down. So for example, one provider or a network provider, they're offering telehealth for doctors at $100. So when you come onto that, your employees can do a telehealth for $100 on the platform. And a particular insurance company said, well, no claim is necessary. So that actually is music to my ears, and it should be music to your ears as well, so that it keeps the cost down. And I think in the early part, I said that, HRMATT Wellness Hub is here to really not only support the employees, it's really to support the employers with respect to the costs for these programs. Any other questions?
There are two questions in the chat, one from Natasha and one from Priscilla.
Okay. Well, so I'm seeing one from Natasha. If we have a broker that assists with our group plan, so we can talk to the broker, because if you already have a group plan, as I mentioned, we can onboard those providers if they choose to, so that the employees have that continuity of care with that same provider. May not be at the same cost, but we can have that conversation individually. Is there a restricted amount of time per call? Consultations normally last between 30 minutes to 1 hour. So that is really the cost, but it can vary from provider to provider and based on the complaint. But usually it's within between 30 minutes and 1 hour. Is there a cost for employers? So yes, the price for HRMATT members, it's $8 per employee per month. And for non-HRMATT members, it's $10 per employee per month. If you are a sole trader, there is a flat fee, annual fee of $120. All of this is TT dollars. And there is a sign-up form that you can use. I don't know if Chris, you could share that form. That goes through more in detail about the sign-up process. And once you sign up and payment is made, we would provide the QR code. Let me just see if I could share this quickly. So I will just kind of give you a visual of it. I hope you can see this graphic. So something similar to this will be provided to your offices, your office space, your meal room, the medics room, wherever it is that you think in your organization, you will place this poster or sticker. And this is really a QR code. So the employees will use their phone, they will scan the QR code, and they will get the information. It will bring you to the Wellness Hub where they can log in for the first time and then start accessing all of the services that we spoke about. For those of you who may not need the QR code, we also have an email link. So all of these things can be done to support the employees logging in.
So I'm gonna share the form so they can see it. But I also got another question here. It was sent directly to me. It says, I was asking in the chat, what is the process to become a medical provider on your network? And this comes from Newtown Medical.
Yeah, you can just send us an email. And we did try to reach out to Newtown Medical. I think the email bounced or something, but we will reach out to you at Newtown Medical to come onto the platform.
Thank you. I appreciate that.
Yes. So I'm just sending the email here. So you can just send us an email. We'll send you the form, and there's no cost to sign up as a provider. So this is the sign up form. It's the HRMATT Wellness Hub a service agreement for employers. It again asks you if you're a HRMATT member or not a HRMATT member. And let me make a plug for HRMATT. If you're not a HRMATT member, do become one today. Visit www.HRMATT.com. That's HRMATT.com. We can put it in the link here. And you can sign up as a HRMATT member to receive that added discount for your organization. Right, so this is a form. Yeah, scroll down. You have, if you're a HRMATT member, you have your HRMATT membership number. You include that there as well. You enter your business information, the position that you hold in the company, whether you HR, CEO, manager, HSC, the title. Yeah, come down. Scroll down and you provide your address. If you have an assistant, you provide that information. We would like to know what area of the of industry you represent, whether it's utilities, education, and so forth. Come down. Yeah, scroll down a little more. And this is where you choose your plan. So the subscription plan, you may have, Chris, if you can click on the quantity. So if you have 10 employees, you enter that there. And when you come down, so if you're paying by the month, you can do that. If it's not, you do it annually. If you come down a little bit, you will see that when you click the 10 employees, you saw the $80 there. So it will cost you for 10 employees $80 per month to access all of the services. And I hope that's clear. If you wish to pay annually, you can do so. And how will you be paying? Bank transfer, credit card. So we went through that page with you where you can have access to all of that information. You come down. So you can click right there on the credit card and that takes you to the link and you can pay right there, or you have the information on the bank information so you can make direct deposits. Yeah, and that really, so this is the credit card. For those of you familiar with WePay, just enter the credit card information there. Please, of course, tell us the company that you're paying from and the number of employees. And that's it. Once we get that information, we will contact you. Now, important part of the service is in order to encourage the two-way engagement, we normally would ask, of course, for the employee listing of the employees who you wish to have on board. Once we get that listing, we can give them the code. We generate a code for them. We will send them either via email or their WhatsApp or their phone as a text message, and then they can access the service. Or if they have used the QR code, they will need that code in order to enter onto the platform so that we know that it's your employees using it and not someone else using the service. Right? I hope I really answered a lot of those questions. We just have about a few minutes left. So are there any other questions?
There was one more question. Can you briefly explain what telehealth is?
Okay, so telehealth became very popular during COVID. Patients could not go to the doctor's offices, so they started to use just like what we're doing here, Zoom, they started to use a video service to talk to their patients. Of course, there are limitations to telehealth. You can't physically examine a patient, but it's very good for routine visits.
Someone here with
Right? It's very, very similar.
sorry.
To like a
human
Zoom,
resources.
to a Zoom or so. So telehealth is something that we use on the platform. So it's basically a video call with between the employee, sorry, and the care provider. There's a question here. Could you just reconfirm if you need an insurance provider? So you don't need an insurance provider to join the platform, but if you have an insurance provider, we like to meet with the insurance provider and your team just to ensure that, you know, if a claim is being made, that it would be accepted by them. But in the past, Sagicor, Guardian, and other companies, they have accepted the claims for telehealth. So we don't really see that as an issue. And as I said, the claims ratio is usually decreased because the cost of the telehealth visits are usually maybe 1/3 less than an in-person visit. Right, so we're almost out of time. Any other questions? This is a very nice audience, no questions. So I hope you all had your lunch. And I really do look forward to, you know, seeing you all signing up very soon, starting to use the program for your employees. Any other questions, you can email us at the admin at Patient Connect email that was sent here. You can reach out to HRMATT through their website. And there's a link that we also posted where you can get a lot more information. So certainly I want to thank you all for attending today. And I really hope that you can also share the information with your other colleagues and other companies so that we could really try to improve the health and wellness of all of the employees in Trinidad and Tobago. So thank you very much again. If there's anything else, any other questions, please feel free to connect with us, and also send your queries to the secretariat at HRMATT.com. And I hope to see you all soon. So thank you very much again.
All right, thank you, ladies and gentlemen, and of course our participants. I think we had a very lively audience and a lot of questions, a lot of information would have been shared. I extend my sincere gratitude to each of you for your presence. I know it would have been lunchtime. Of course, we want to thank the president of HRMATT, Cavell. We also would like to thank Dr. Navi Murdali. And an appreciation to not just the speakers, but the partners, the sponsors for their expertise and support and insights for today's proceedings. As we conclude this webinar, let us carry forward the knowledge shared and connections made to foster continued collaboration and innovation in our respective fields, and of course, about wellness. So have a wonderful afternoon.
Cavell, you have the final say?
What could I say after you, Dr. Muradali? Thank you for an excellent presentation and bringing this information to all the participants here. And certainly we look forward to onboarding multiple organizations and individuals onto this platform. Again, the aim and objective all centered around overall health and wellness, recognizing now more than ever we need to take care of ourselves. And this is our way of providing affordable, accessible services to each and every one of you, your employees, and yourselves, you know. So we look forward to, again, you all getting on board with HRMATT's Health and Wellness Hub. So thank you, Navi, and we will be in conversation soon. I know several persons are in fact looking forward to potentially this video also being circulated. A few people who can attend the WhatsApp me during the presentation. So we can expect in the near future for us to circulate the video presentation to everyone who was in attendance today. So thank you. Have a blessed afternoon, everyone, and we look forward to welcome you welcoming you and your team members to the Wellness Hub. Yeah.
Thank you.